So autonomic nervous system. Autonomic nervous system is consist of peripheral nervous system in that it consists of motor portions of some cranial and spinal nerves. Because its functions is so specialized, however, the autonomic nervous system is usually discussed as a separate entity, as we will do here. So basics of autonomic nervous system we talked in previous class, but I will resume that. Okay, so हम लोग यहाँ पर ऑटोनोमिक नर्वस सिस्टम पढ़ेंगे जिसमें ये बताया जा रहा है कि ये सिस्टम है कि आपको इस सिस्टम के बारे में ब्रेन से जो सिग्नल्स आते हैं वो आपको इल्म नहीं होता उसका, यानी वो अपना काम रेगुलरली 24/7 करते ही रहते हैं. मीन्स हियर द impulse which are coming from the brain and utilizing or functioning our body, basically we doesn't have sense about that. Okay, so there's the reason autonomic nervous system. So basically uh, some nerves are coming from the brain, some nerves are coming from the spinal area. So we have both cranial and spinal nerves. So we have visceral motor neurons. I repeated in early class, visceral motor neurons and visceral effectors. Okay, so basically you can see that video. So the ANS, basically the ANS means autonomic nervous system has two divisions. So अब जब ये ऑटोनोमिक नर्वस सिस्टम काम करता है तो दो तरीके से काम करता है, इसके दो डिविजन्स. व्हाट आर दोज डिविजन्स? सिंपैथेटिक एंड पैरासिम्पैथेटिक. वन इज सिंपैथेटिक एंड another one is parasympathetic. This is the one and this is the two parasympathetic. Often they function in opposition to each other. So how they function? Parasympathetic is opposite to sympathetic and sympathetic is opposite to parasympathetic. Okay, if it is sky, opposite earth. Okay, it is big. If it is big, it is short. So likewise, parasympathetic and sympathetic are both are different to each other. They function in opposition to each other, as you will see. So दोनों के दोनों क्या है, एकदम opposite में काम करते हैं. ठीक है. The activity of both divisions is integrated by the hypothalamus. So who will integrate the work? Hypothalamus. In the brain we have hypothalamus. From that area the function is integrated. So यहाँ पे जो कंट्रोलिंग सिस्टम किसके पास है? हाइपोथैलेमस के पास है कि वो क्या करेगा, बहुत इस फंक्शन को इंटीग्रेट करेगा सही तौर पे. ठीक है, पैरासिम्पैथेटिक और सिंपैथेटिक दोनों के, which ensures that the visceral effectors will respond appropriately to the situation. तो इसमें सबसे ज्यादा जो effectors है, effectors मतलब वहां पे लोकली जो इंफॉर्मेशन को देकर ब्रेन तक पहुंचाते हैं, ब्रेन के नर्व तक पहुंचाते हैं. ठीक है, उसको हम वेसिरल इफेक्टर वहां पे कहेंगे. तो उनको ये सिचुएशन बहुत ज्यादा ध्यान से देखना पड़ता है. सो बेसिकली इफ इट इज स्टमक, इट इज हार्ट. ओके, so we have here visceral reflectors which will absorb the heart rate, heart pumping, everything. So anything will fall down or raise, it will assume that the condition is not properly working here. So it will send the sense. Okay, so these are the visceral effecta. Okay, they have to respond according to the condition. So यहाँ पर हर एक ऑर्गन या फिर हर एक एरिया के पास कुछ इफेक्टर्स होते हैं, इफेक्ट करने वाले, सेंस करने वाले इफेक्टर्स होते हैं. तो इनको क्या करना है, दो चीजें करना है. तो इंफॉर्मेशन लेके जाना है, या तो जो इंफॉर्मेशन ब्रेन से आ रहा है वो इंफॉर्मेशन को ये क्या करेंगे, अफेक्ट करेंगे, यानी प्रॉपर उसको अप्लाई करेंगे. ठीक है, तो हियर two थिंग्स आर मोस्ट इंपॉर्टेंट. वन इज हाइपोथैलेमस एंड Second one is visceral effector. Here we have one pathway. So ऑटोनोमिक pathway कैसा काम करता है, यानी ब्रेन से कौन से इसके pathway होते हैं, जैसा कि अब ब्रेन से स्पाइनल कॉर्ड आया, स्पाइनल कॉर्ड से ऑर्गन तक आया, ठीक है, ये एक pathway हो गया। फिर ऑर्गन से स्पाइनल कॉर्ड गया, स्पाइनल कॉर्ड से ब्रेन गया, ये सेकेंड pathway हो गया। और एक pathway हो सकता है स्पाइनल ब्रेन से स्पाइनल कॉर्ड गया, फिर स्पाइनल कॉर्ड से एक न्यूरॉन निकला, फिर वहां से और एक न्यूरॉन, दूसरा न्यूरॉन, फिर ऑर्गन पे लेके गया, ठीक है, ये एक पाथवे। फिर और एक फोर्थ पाथवे हो सकता है, यहाँ से एक न्यूरॉन निकला, फिर और एक न्यूरॉन को अटैच किया, फिर स्पाइनल कॉर्ड को गया, स्पाइनल कॉर्ड से ब्रेन गया। सो दीज आर द, आई थिंक, डिफरेंट डिफरेंट types we can understood. So here one single neuron can send the sense or affect the motor system, okay, or double neuron can affect the sensory or motor outputs. Okay, here we understood automatic pathway. So how the autonomic pathway works? Autonomic near pathway from the central nervous system. From the central nervous system means it may be spinal cord or it may be brain. Okay, visceral effector consists of two motor neurons that synapse in a ganglionic outside the CNS. The first neuron is called pre-ganglionic neuron from the CNS to the ganglion. The second neuron is called post-ganglionic neuron from the ganglion to the visceral effector. The ganglia are called actually the cell bodies of the post-ganglionic neuron. So basically, you can see in this 812 here, you have the image, you can see this is the central nervous system you have. Okay, this is the central nervous system, you can see. So you have the midbrain here. From the midbrain you have erasing here one pathway in pons or medulla oblongata, we have the pathway. So basically from this region we have the nerves, you have divisions, okay, divisions, okay. So this is called preganglionic neuron. Basically it is preganglionic neuron. So if the first neuron ends, then we call it the second neuron. Here we have that is postganglionic neuron. Basically the ganglion is a group of cell bodies. What we call ganglion is a group of cell bodies. Okay, next here you can see that from the spinal cord we have dorsal region. From the dorsal region we have number of neurons are erasing. Okay, so this is the and we have the preganglionic neuron. Here we have the, you can see that from that number of nerves are erasing. These are the postganglionic neuron. This is the pre and these are the post. Okay, from that the number of nerves are attaching to the different parts of the body. Okay, so I think this is very very important to understood. Is the now you are able to see. So this is very very important. Okay, because every nerve is coming from the central nervous system, from the brain or from the spinal cord. You can observe. Let's see here one of the nerve is coming, that is medulla, from the medulla. Okay, here we have the coming vagus nerve. This is the vagus nerve we already talked about. So this vagus nerve is coming and it have divisions. One is for trachea and another division is for, here we have the trachea, bronchioles, and another division is for heart, another division for liver here, and another division is for stomach, another division for small intestine, large intestine. Okay, so this one branch will supply multiple organs. Okay, so you have to remember that. So this is the pre uh, post and pre ganglionic neurons. Okay, sympathetic division. Another name for the sympathetic division is the thoracolumbar division, which tells where the sympathetic preganglion neurons originate. Their cell bodies are in the thoracic segments and some of the lumbar segments of the spinal cord. Their axon extend to the sympathetic ganglia, most of which are located in two chains just outside the spinal column. Within the ganglia are the synapses between preganglionic and postganglionic neurons. The postganglionic axons then go to the visceral effectors. One preganglionic neuron often synapse with many postganglionic neurons to many effectors. These anatomic arrangement has physiological importance. The sympathetic divisions brings about widespread response in many organs. So basically, uh, this is the this is the thing they want to explain the whole diagram in the theoretical manner. Okay, you can see that this is the sympathetic pathway, means it is situated in the thoracic lumbar region. Okay, one of the uh, nerve. Then we have the ganglion. Then from another raise another synapse there. Synapse, you can see this is the synaptic where number of nerves are coming and attached together. Here then another neuron is there which is arising from that and reaching to the another or any organ. Okay, this is the synapse. Okay, and this is the ganglion. This is the postganglionic neuron. After that, preganglionic neuron. Sorry, preganglionic neuron. This is the preganglionic neuron. This is the postganglionic neuron. These are the all are postganglionic neurons. These are the all are preganglionic neuron. These are the ganglions. Okay, so these are the things you have to remember. All these things are given in theoretical way. The sympathetic division is dominated in stressful conditions. So when we use sympathetic division, I already told that flight or fight mode means whenever emergency condition will occur, this sympathetic condition और sympathetic pathway will activate. तो ये कब आपको देखने को मिलेगा sympathetic pathway? आपको देखने को मिलेगा स्ट्रेसफुल कंडीशन के मौके पर, ओके, फाइटफुल कंडीशन के मौके पर, ठीक है, जैसा कि गुस्सा, गुस्सा आ जाना, डरना, ठीक है, और एकदम घबराहट, एंग्जाइटी, किसी चीज से आपको कुछ नुकसान महसूस होना, या फिर एक्सरसाइज करते वक्त, ठीक है, तो ये सब चीजें जो है आपको देखने को मिलती है। सो सिंपल में इसको याद रखिए, फाइट और फ्लाइट रेस्पॉन्स, सिंपैथेटिक एस एफ एफ, ओके, एस एफ एफ, sympathetic means fight and flight. Okay, our nervous system haven't changed very much in 50,000 years. You will see the kind of response the sympathetic division stimulates, the heart rate increases, vasodilation skeletal muscle supplies them with more oxygen, the bronchioles dilate to take in more air, and the liver changes glycogen to glucose to supply energy. At the same time, digestive secretion decreases, peristalsis is slow, they are not important in a stress condition. Vasoconstriction in the skin, visceral shunts blood to more vital organs such as heart, muscles, and brain. All of these responses enabled our ancestors to stay and fight or to fight away from the potential danger. Even though we may not always be in life-threatening situation during stretch, our bodies are prepared for just that. So basically here, why the sympathetic pathway is given for us for to fight in fight or flight conditions. for stressful condition, for fearful condition, for anxiety. Okay, so basically what will happen? So let's see that what will happen in in stressful condition. What will happen? It happened that whenever uh, you run or you do exercise, okay, you do exercise, what will happen? Vasoconstriction will happen, or vasodilution may be happen. Means vessel will be dilated, more blood will come to the vital organs like brain, okay, brain and muscles and your lungs. Okay, so it will work more. But vasoconstriction also happen some organs like stomach, the movement of stomach, the digestion process decreases, and the peristaltic movements of small intestine and large intestine will decreases because it is not important when we are in emergency condition, but the muscles have to fight or want to run. Okay, that's the reason muscles need more oxygen and more energy, and the heart rate increases and the respiratory increases because to supply the demand of the body. Okay, you need more oxygen, you need more blood supply. So that's the reason your heart rate increases to supply the demanding parts of the body, mostly brain and muscles, lungs. Okay, so that's the reason these are the things happen while you are in stressful condition. So if you take more stress, what will happen? So these vital organs will work more. So whenever you are in stressful condition, kindly observe. Okay, if you are doing exercise, you can observe. You have to imagine what are happening in your body, or when you are in stressful condition, what will happening. So basically, you are in anxiety condition. What will happen? Sympathetic pathway activity. Your digestive system will not happen properly. Okay, you will get constipation. Okay, and your brain work very fastly. You're thinking, you think very fastly, and you want to do anything. Okay, so these are the conditions you have to get when you are in fearful condition or anxiety or depression or in flight condition, flight or fight condition. Okay, next we have parasympathetic division. What is parasympathetic? And you know that parasympathetic is opposite to sympathetic. Let's see. The other name of parasympathetic is craniosacral division. Craniosacral division. The cell body of parasympathetic preganglion neurons are in the brain stem and the sacral segments for the spinal cord. Their axons are in cranial space 3, 7, 9, and 10 in some sacral nerves and extend to the parasympathetic ganglia. These ganglia are very close to actually in the visceral effector and contains the postganglionic cell body with very short axons to the cell of the effector. In the parasympathetic division, one preganglionic neuron synapse with just a few postganglionic neurons, the only one effector. With this anatomic arrangement, very localized one organ's response are possible. So basically, you can see that this is the region where you have parasympathetic area. This is the parasympathetic where you have the midbrain, medulla, and as well as in the sacral region. Okay, so basically it is here you have preganglion. You can see that this is the preganglion. This is the preganglionic area. This is the here you have the short, very short effector, that is postganglionic neuron. But in the parasympathetic, you can see there is the preganglion very short, but postganglion is very large. So this is the difference in post parasympathetic and sympathetic. Okay, so this is the main difference you can see in the parasympathetic and sympathetic pathway or division. The parasympathetic divisions dominates in relaxed situation to promote normal function of several organ system. So what is the function of the parasympathetic? Parasympathetic is for normal function. Now I am in the normal mode or normal way. I am talking, I am explaining, but some stress is there, but it can be bearable. Okay, I have to take my voice very largely to deliver the explanation. Okay, so there's the reason I have some stress, but when you are listening, you are in the calm mode, pleasant mode, you are listening the class, so you are in parasympathetic condition. I am mild sympathetic condition. Okay, so what will happen? Your digestion will very normal. Your peristaltic movement are normal. Your maybe your urination will occur, and heart rate very normal rate 70 to 80. Okay, other function of the division are listed in 8.5. So these are the other functions in sympathetic and parasympathetic. We'll see after that. Notice that when an organ receives both sympathetic and parasympathetic impulse, the responses are opposite. An arrangement makes maintaining an appropriate level of activity quite simple, as in changing the heart rate to meet the needs of a situation. Notice also that some visceral effectors receive only sympathetic impulse. In such cases, the opposite response is brought about by decreasing sympathetic impulse. Secretion by sweat glands is example. So what will happen if you notice that same organ, if some organs are there, they are working in sympathetic and parasympathetic. Okay. So basically when they are doing sympathetic pathway function, you will see some quite simple difference. They work while same organ is functioning parasympathetic pathway. So you may see different function. Opposite functions also seen, like in the sweat glands. In the sweat gland, when you are in the calm mode, you are in the parasympathetic pathway mode. What will happen? The sweat gland doesn't give sweat. Means you are sweating, you are not will not get sweat, it is not doing functioning. But when you are running, you are fearful, what will happen? The sweat glands release the sweat from the skin. Okay, some organs have opposite direction, some organs have same function. Okay, here some of the neurotransmitters we already studied, but here again they are giving. Neurotransmitters means the language the neurons talk to each other, or the neurons release the neurotransmitter to other organ to explain his things, explain his function. Okay, so this is the very simple thing. The neurotransmitters enable nerve impulse to cross synapse. In autonomic pathway, there are two between preganglionic and postganglionic neurons, and the second between postganglionic neurons and the visceral effectors. Acetylcholine is the transmitter released by all preganglionic neurons, both sympathetic and parasympathetic. It is inactivated by cholinesterase in postganglionic neurons. Parasympathetic postganglionic neurons all release acetylcholine at the synapse with their visceral effectors. Most sympathetic postganglion release the transmitter norepinephrine at the synapse with the effector cells. Norepinephrine is inactivated by the either cortical or methyltransferase or monoamine oxidase, or it may be removed from the synapse by the reuptake. So basically here explaining that where the cholinesterase is using, sorry, where the acetylcholine is using, where norepinephrine is using. So basically in the parasympathetic pathway, you can see that acetylcholine is there, the parasympathetic pathway from the preganglionic neuron to postganglionic neuron. But in the sympathetic pathway, non-epinephrine, non-epinephrine, non-epinephrine is a neurotransmitter. Here we have the effector cells. These are the effector cells. Here we have the, when the effector is there, so it is releasing here in the parasympathetic pathway which neurotransmitters, norepinephrine. So you have to remember this. This is a very, very important. So here we completed our sympathetic and parasympathetic pathway. Here one of the something are there, age and the nervous system. So let's talk about that. The aging brain does lose neurons, but this is only a small percentage of the total and not the usual cause of mental impairment in elder people. For more common cause are depression, malnutrition, hypotension, and the side effects of medications. Some forgetfulness is be expected, however, as it is a decreased ability to rapid problem solving, but most memory should remain intact. Voluntary movements become slower, as do reflexes and reaction time. Thinking of driving a car. So basically, the brain, if we are in normal or normal function or normal body, as age increases, the neuron lose very little about their degeneration. Okay, if you're healthy most of the time, all your life, so the neurons lose mostly some part of the neurons. It is degenerated. But what is the main cause of mental impairment or forgetfulness? Why this is have disability to problem solving, walking, okay, reflexes, or reaching to on time. So because of explanation is there, because of depression. Depression is very harmful for the brain. Second thing is malnutrition, not reaching of necessary amount of nutrition to the brain. ओके, सो बेसिकली क्या हो रहा है यहाँ पे, ब्रेन जो फंक्शन नहीं कर पा रहा है, उसका रीजन क्या है? उसका रीजन मोस्टली एजिंग, ये बहुत लेस है। एजिंग से 5 to 10% डैमेज होने के चांसेस रहते हैं। लेकिन डिप्रेशन और सही खान पान ना रहने की वजह से और बीपी की वजह से, यानी बीपी में भी क्या होता है, या तो हाइपरटेंशन या हाइपोटेंशन, हाइपोटेंशन यानी खून की दौरानगी कम हो जाना बॉडी में। तो इससे भी क्या हो सकता है, ब्रेन सेल्स डैमेज हो सकते हैं। एंड मोस्ट मोस्ट इंपॉर्टेंट नाउअडेज दैट इज साइड इफेक्ट्स ऑफ मेडिकेशंस, काइंडली नोट दिस। सो बेसिकली द मोस्ट common cause of neurodegeneration is most using of drugs. Okay, so all every from the birth of the baby to the death of the person, everyone are using medication, drugs nowadays, very common. Okay, if they got pain, they will go and they buy the painkillers. What the painkiller does? The painkiller stop the sensation, not it will kill the pain. Okay, if the effect of the medicine will gone, then again they will got pain. Okay, so advise your colleagues, advise your family members, kindly avoid these medications which harm the body. Okay, to your patients also. Okay, and kindly, he only the who wrote this book, he is saying that the side effects of medications. Now, yeah, people want to use costly medications. They want to consult higher doctors. Okay, they will write thousand rupees of medications. Okay, so we have to decrease the use of amount of medications. Okay, then only we will protect our family members, friends, colleagues. So that is the reason behind the degeneration of brain. One of the reason. Okay, so basically these are the things we have to remember. So this is all about the central nervous system. So I think we missed the boxes, na? Okay, these are the boxes are there. So we will complete tomorrow. Okay, all the boxes of this central nervous system. Okay, if any doubts, you can ask.